I'm I'm happy to see you're in, and I'm glad that you're going to be starting tomorrow. Given the fact that you're going to be starting tomorrow, what about let's talk about Saturday, okay? And I'll send you a text. All right. Okay. That being said, I'd like to finish the ethical cases tonight and talk a little bit about professional liability. So I think we did A, B, C, and D, and we have E, F, and G to do. All right, so do you remember your groups? Because whoever is ethical case E, does anybody have any questions about anything before we start the ethical cases? So remember, what you're going to do, your group will read the case. You will tell us which principle of the Code of Ethics is being violated and what the rules are. And remember, this is an assignment that I need you guys to do as written because you're going to take it and put it into your portfolio. So we're actually going through the cases. And I'm just going to put like 100 on them. And then what I'm going to do is give you, put them back so you can put them in your portfolio. Nicole, hold out on the graduation question until the end if you don't mind, so we can get through the cases because we have very limited time, unless it's a quick and fast question that I can ask, because I want to move on to ethical cases. And I also, your next class is next week, and you guys have comps. You will not be able to walk in August because there's no August graduation. So the only time you could walk will be in December. Okay? And so that is true. Okay. All right. So let's do this. Let's see if we can go to, we did that one, we did that one, we did that one. We did that one. Okay, so here is ethical case. Let's see. Let's move this up. I'm sorry, I'm trying to get my cursor to work. And I am recording. No, your site is Bowling Green, and we've been in contact with you. Legal is in contact with your site. I think that you and Damien will be able to go forward very soon. It's just they're holding an addendum for some strange reason. Well, then it's not you then. Where's your site, Aaron? Well, then why did she tell me Bowling Green? Well, good. Then I'll feel better about that. Okay. So then, okay. Yeah. Is it you, Alana? Are both of you? She was confused. So it's you, Whitney. Okay. All right. Thank you so much. This is killing me here. Okay. Let's go ahead and get started. And whoever has this case, whatever group has this case, take it away. Okay, thank you, Whitney, for letting me know. Okay, group, let's go. Who has KC? Group, what group has KC? Hello, can you guys hear me? Okay, do you remember the groups you were in? Because I didn't write them down. So somebody has KC. Okay, let's go then to case G. Well, who has case F? Well, let me put it this way. Okay. You had D, so probably alphabetically after us. Okay. All right, so the last person was Jillian. So Kelly, Linda, Lindsay, and Melissa Dowdy, did you do your case? You already went, so it would be, so Nicole Booth, Nicole Compton, Sarah Sewell, did you guys do your case?
Dr. Smith, you gave Melissa, Nicole C., and myself case F. So I don't know if we got out of order, if there was a lot of people on mobile last week.
Okay, well then let's go to case F, because we just want to get through a couple of cases. And let's do case F and then case G. But let's look at this case right quick, and anybody can, well, have you guys all done the cases? Okay, if you've all done the case, let's look at this case right quick, and then we'll go forward with F and G. Okay, so I'll read it. The Heathcliff and Garfield Corporation hires SLPs to provide contracted services to nursing home residents. The SLPs are instructed to provide the maximum services allowed to residents with Medicare benefits and to document progress. Even if, I don't know what's going on. Even if a client does not respond to making progress towards meeting objectives. Okay, so that being said, hold on for a minute, guys. I need somebody to tell me what principle and what rule. But hold on for a minute. Dr. Gibson is calling me. I must take this call. Can you hear me? Can you hear me now? Okay. If you can hear me, indicate by saying yes, because it's telling me my connection is failing. Hello, can you hear me?
We can hear you. We can hear you. We're typing yes.
Okay, thank you so much. Thank you. Or anybody can raise their hand and say. Okay, Jill, give me a principle.
I had put principle 2 and then points C and D and G. So let me go to those.
Yeah, go to those and read them right quick.
Sorry. 2, A, B. Oh, wait, where is it? So 2C, sorry, I must have opened the wrong code of ethics because it's kind of out of order.
Okay.
Oh, sorry, if somebody else has it in front of them, they can read it. I'll look at it. I'll find it really quickly.
Okay. Principle 2, individuals shall honor their responsibility to achieve and maintain the highest level of professional competence and performance. Okay, so why did you choose these?
I don't know.
Okay, so did anybody else
I can't find
the
copy of my.
Oh, wait a minute. You guys are typing in my thing. Okay. All right. So look at the principles, guys. Well, first of all, Kelly, go ahead. Jill, while you're looking at yours, because I'm curious as to why you would have chosen those.
Okay.
Kelly.
I said principle 1, rule K, principle 3, rule C, D, and G.
Okay, so so tell us what the principles are so that we can look to see if in fact they apply.
Okay. So principle, hold on, I'm looking on 2 different pages. Let me scroll down. Okay.
Principle 1, Rule K says, individuals who hold the Certificate of Clinical Competence shall evaluate the effectiveness of services provided, technology employed, and product dispensed, and they shall provide services or dispense products only when benefit can reasonably be expected.
Okay. Why did you? So when we look at this, what makes you think that that is a good? That's a rule that's being violated.
Because they're doing it even if they're not responding to progress.
Okay. All right. Very good.
I said Principle 3, Rule C, B, and G. So that is C is individuals shall not misrepresent research and scholarly activities, diagnostic information, services provided, results of services provided, products dispensed, or the effects of products dispensed.
Okay.
And then also D, individuals shall not defraud through intent, ignorance, or negligence, or engage in any scheme to defraud in connection with obtaining payment.
Definitely. I said definitely.
Yeah, or grants and contracts for services provided, research conducted, or products dispensed. And then also I said G, individuals shall not knowingly make false financial or I wasn't sure that one applied. I wasn't sure exactly what that one meant. Make false financial or non-financial statements and shall complete all materials honestly and without omission. Okay. So the honestly part.
All right. I actually agree with all of those. Okay. Anybody else have some? Because anybody else have anything else? Jill, can you figure out why you would say 2?
Dr. Smith, I did have one more.
Okay, go ahead.
4E, and it just says individuals shall not engage in dishonesty, negligence, fraud, deceit, or misrepresentation.
Absolutely. Okay. Anybody else?
I had another one.
Sarah? Oh, yeah, I see your hand raised, Sarah. Go ahead.
I also added Principles of Ethics 4I. I don't think Kelly said that one.
Okay.
Individuals Individuals shall not knowingly allow anyone under their supervision to engage in any practice that violates the code of ethics.
Yes, I see that could be a problem too. And this is anybody else. Oh, I cannot believe I just closed the code of ethics. Okay, so yes. Okay, whoever raised their hand. Go ahead, Sarah.
Okay, Rule N also under Principles of Ethics 4. I don't believe that one was mentioned. Individuals shall report members of other professions who they know have violated standards of care. Maybe that one doesn't fit. I was just thinking
that one doesn't.
Yeah, never mind. As I read that, just kidding. Erase it.
No. Okay, that's okay. All right. Kelly, did you raise your hand again?
While I was thinking M, it says individuals with evidence that the code of ethics may have been violated have the responsibility to work collaboratively to resolve the situation where possible or to inform the Board of Ethics through its established procedures.
Well, it definitely is an ethical problem, but it doesn't say we don't know whether the SLPs are reporting the company or not. We just know that Heathcliff in the Garfield Corporation has instructed SLPs to provide the maximum service, even if it doesn't respond. So reporting they may have done. So the big problem we see is that in essence, individuals have not, these SLPs, it's unethical for them to bill for services that are not required, and the corporation just wants to make money. So what is the solution? Hold on for one more minute, guys. Just think about that. Somebody Okay, guys, what's the solution to this? What's the solution to case E? Anybody? We know there's a problem with fraud here. We know that if these SLPs do this, they can lose their license, but they can also go to jail. You're talking about billing somebody and doing services just to get their Medicare, documenting progress that they, even if they don't respond, just so you can get the money. So this is illegal. So what would be a solution? If you were put in this situation, what would you do? Anybody, what would you do? Okay, Jill.
I would quit the job most likely. I mean, my first would be to go to the administrator maybe above this person and report it and definitely not do it. And if they really required me to, then I would quit and report them to the state board and to ASHA.
Excellent. Absolutely excellent. This needs to be reported. You don't ever need to be in a situation like this. Again, you can lose your license. Worse, you can go to jail. Okay? Okay. All right. Anybody else have anything to say about this case before we move to case F and case G? All right. Now, the reason I'm taking time to go through these ethical cases is because you won't believe the number of people that commit violations in this profession, and they get reported in the ASHA leader. So you've commit a violation. If you get sanctioned, you could lose your license, and that is public knowledge. Okay. That being said, let's go to case F.
Okay, for case F, it says an SLP refuses to treat a client who is HIV positive, and we chose Principle of Ethics 1, Rule C, which states, individuals shall not discriminate in the delivery of professional services or in the conduct of research and scholarly activities on the basis of race, ethnicity, sex, gender, identity, gender expression, sexual orientation, age, religion, national origin, disability, culture, language, or dialect.
Absolutely excellent. That is correct. Anything else? Anybody see anything else that would apply? Okay, I can't think of anything else that will apply here either. This is a clear case of discrimination. So what would you do if somebody came to you for services and they were HIV positive? What would you do? What is the solution to this?
So you can't refuse to treat them. That's unethical. And so the treating SLP would use universal precautions, and that would be wearing gloves and assuming that all body fluids are infectious.
That's right. That is what you can do. Now, the only reason that you might not be able to see a client who's HIV positive is that you don't, you have a, well, first of all, you might not, most of the time, you're not going to even know whether they're HIV positive or not. So you always have to use universal precautions. But secondly, if, for example, someone came to me for services, but I only catered to a certain type of client, like, for example, if I only worked with preschoolers, which at Scottish Rite I only did, okay? So if, for example, this person was an adult but just wanted services and my facility didn't cater to adults, then I wouldn't have to serve him. I would have to refer him somewhere where he could receive those services based on the clientele. But if you just are refusing services to this person because he's HIV positive, you are violating his civil rights. And so that's a case of discrimination. Okay? All right, let's move to case G, and then we're going to stop and go into professional liability and how do we resolve the types of issues that we might be faced with and what might we be sued for. Okay, last group, take it away.
So we had rule ethics case G, which was this one that's up here. So we picked principle 1.
Okay, read the ethics case first.
Okay. You are the clinical director in a rehabilitation hospital setting. A pregnant speech-language pathologist in your unit refuses to treat a client who is HIV positive. So this is
same one as
similar to...
Yep. Go ahead.
Exactly. So we did Principle 1, Rule C, which Nicole read, individuals shall not discriminate in the delivery of professional services or in the conduct of research and scholarly activities on the basis of race, ethnicity, sex, gender, identity, gender expression, sexual orientation, age, religion, national origin, disability, culture, language, or dialect. And we also put in Principle 4, Rule N, which is individuals shall report members of other professions. Okay. So with this one, just like Melissa said, there should be...
And the basic difference in this one is the first one you're refusing to serve, but the second one is you're actually the director of a clinic, and one of your SLPs is refusing to serve. So she's violating the discrimination law, but as the director, what would you do?
I would tell her as well to use the universal precautions and that she just needs to get herself re-educated. That there's absolutely no reasonable basis that she has that, that she can't treat that client. You need to put her at ease because I understand she's pregnant and she feels like, she's going to get a whole bunch of stuff everywhere she goes maybe. But, there's no reason why she can't treat that person like any other person who would come to her for help.
Yeah, and you can imagine the scare, but the truth of the matter is people are going to walk into you guys every day and they're going to have something that you know nothing about. So you can't knowingly discriminate against someone unless it puts yourself, if you adhere to universal precautions. Plus the other thing is, I can't imagine you would just actually know, but if you do, you have to adhere to HIPAA, FERPA, and all those guidelines. And you have to follow your units or your settings procedure for dealing with clients who may be in a situation where you're at risk. So nurses, doctors deal with this every day, and you are in the profession and you have to you're in a healthcare profession and you're going to have to deal with these issues. Okay, so what I want you guys to do with these ethical cases now is I'm going to just put a grade on them, and I want you to just put them in your portfolio under the section that talks about ethics. And this will be one of your pieces that you use for a portfolio. So that being said, while we're talking about ethics, then let's look to see now, okay, what happens? We understand what the Code of Ethics says. We understand the rules and what we can and cannot do. I'm going to upload the professionalism and professional liability risk management PowerPoint, and then we're going to talk about what do we do when we have an issue. Wait a minute, if I can, that arises. How do we protect ourselves? Okay. So we're going to talk about the types of liability, and then we'll talk about how do you manage the risk, okay? And it really is important to think about these types of issues because you are an SLP, and no matter who you're working for, whether you're working for yourself or you're working for somebody else, you are at risk for being sued. This is a litigious society, and people will sue you at the drop of a hat. So that being said, Let's look at professionalism. And we are in a discipline that is a professional discipline. It's a professional discipline because we have a code of ethics, because we have a scope of practice, because we have a content area around which you are trained, and our content area is communication and communication disorders. So we require, all professions require that everybody act professionally. And the acting professionally may involve you or may indirectly involve you. So the professionalism has to do with the types of tasks and responsibilities that you are assigned to carry out. It has to do with the individuals to whom you are responsible and who you serve, because your code of ethics tells you you have to hold the safety of your clients and paramount, the welfare of your clients paramount. And those ethics, the licensure laws that are in place are there to protect the consumer. They're not there necessarily to protect you. They're there to protect the consumer, and indirectly they do protect you. Okay? And then you also have to have professional relations with other professionals, which means that you cannot go out talking badly about someone and then think that that's not going to come back to hurt you. You can't go and hurt people in a profession just because you don't like them, or say something about them just because you don't like them, because it could do them harm. So the way that you become a professional and you remain professional is to constantly go through training and education so that you understand the rules, you understand the law, because ignorance of the law is no excuse, okay? These are some of the behaviors that you have to follow through with to be a professional. First of all, you have to show up and be prepared, be on time, be in the frame of mind that is appropriate for you in terms of professional tasks. You have to be properly attired. So that's part of being a professional. When you go to professional meetings, when you go to your job, if the dress code is a suit, then that's what you wear. If the dress code allows you to be more casual, then that's what you can wear. But you have to be prepared to do your job, and that's why you have something called continuing education. Okay, so when we talk about professionalism, we're talking about you placing the importance of professional duties, tasks, and problem solving above your own convenience. You striving to work effectively for the benefit of the people that you're serving, properly crediting the work to people who have done the work, and taking responsibilities for your actions, your reactions, and for your inactions. All of this goes to professionalism. And when you don't do that, and I'm going to give you an example, you could be sued or you could lose your professional license. Okay. All right. So if there is some type of situation where, for example, the client thinks that you have not done due diligence to make sure that they are receiving appropriate services and that they are in a safe environment, you could be sued. A good example would be, let's say, for example, somebody spills water in your place of work where you're seeing your clients, and you don't do due diligence to make sure that that water is cleaned up. You can do that by wiping it up. You can put signs around that area, just like you do in a grocery store, making sure that nothing happens to your client, because as soon as your client walks in and slips and hurts themselves, you could be sued. And this actually happened with with one of the chairs. I'm not going to mention the department, but she went to a faculty member's house for an event. She came in the back door, and there was no lighting in the back area of the home, but there was also a broken step. She fell, she broke her ankle, and she actually sued the faculty member. She sued the faculty member because it was the faculty member's responsibility to make sure everybody came in the front of her house, to make sure there was proper lighting if she was letting people come into the house, and to make sure that it was safe for people to walk on the steps. My husband actually sued his job for something very similar. So things that we take lightly are things that could get you sued. You would say, well, that's a faculty member. Why would she do that? Well, because her son insisted that she do that, and on top of it, she had medical expenses that needed to be paid. So these are the kinds of things that you think about. So solutions to reduce your professional liability are: be professional at all times. If you make a mistake, correct the mistake to the best of your knowledge. Most people are going to be reasonable unless you do things outrageous. The big issue is to make sure that you have malpractice insurance, and to make sure that you adhere to the scope of practice, which is why we did those cases and went through the code of ethics. And you have to understand your code of ethics. You have to know what's in your scope, okay? So you can't go do something out of your scope that, let's say, maybe is in nursing scope, but it's not in yours. A good example would be somebody wants you to, let's say, well, I can't even say that because sometimes we do transfer patients. But if you don't know how to transfer a patient safely, you don't need to be doing that. Nurses need to come in and transfer patients from the bed to the wheelchair or wherever they need to go, because if something happens to that patient, you're responsible. So these are just things that I'm kind of thinking about. So it's not in your scope necessarily. We don't train you to transfer patients. We don't necessarily train you to do a lot of things that nurses do. And, you know, when I was in the airport coming, just for an example, I can push a wheelchair. I was pushing my mom in a wheelchair, but generally what happens is airport personnel will step in sometimes and they will push those wheelchairs down the ramp so that the person can get on the plane. They do that because the ramp is, it has elevations and depressions. So if my mom were to have fallen out of the wheelchair while I was trying to push her down the ramp to get on the plane, I could have sued the airlines. So I was able to push her to the gate, but once I got her to the gate, they said, nope, line her up here, and only airport personnel transferred her, you know, people in the wheelchairs to down that ramp. So those are the things that you kind of think about. That's out of my scope. That's in their scope. They have somebody to do it. So that's what you do. Anybody have any questions about what I mean by the fact that you have to adhere to your scope? You have to understand the code of ethics. Everybody clear on that? I mean, something very simple could get you sued. Okay. So let's talk about professional liability. And then I want you to think about situations in your site where that could potentially be something that could cause you to get sued, okay? Because you are working with patients. I know everybody has malpractice insurance because we do not allow you in without malpractice insurance. But professional liability, what is it? This is injury caused either intentionally or unintentionally to another person. It is unprofessional or unethical practice that is the basis for the legal claim. Okay? This is what we mean when we talk about professional liability. And the reason why you have to consider this is because there are an increasing number of legal cases. People, again, will sue you in a minute. The reason is you have a lot of people are majoring in the area of speech-language pathology, so we have an increase in the number of practitioners. So more than likely somebody is going to violate some rule of the Code of Ethics. Because you have individuals that you're serving and you have an increase in the number of individuals that you are serving, then more than likely somebody is not going to be happy with all the services that you are providing. The scope of practice is expanding, so we have something called multi-skilling. So what you have is cross-discipline kinds of behaviors that occur among professionals. So the likelihood is that if you really aren't adequately trained, you can be sued. Sometimes you can be sued because people are saying, well, you know what, that's not in your scope. We have professional autonomy. So like, for example, swallowing. That OT might feel that, well, that's in their scope, but PT might feel that, well, that should only be in my scope. Okay, so all of these are possible reasons. So anybody, you guys are in sites now. Have you been in any type of situation where you potentially could have seen that some liability could have occurred to you or based on the clients that you're serving? Anybody seen anything like that in your settings? And I'm asking, so if you do, or if you have, raise your hand. Okay, Jill. And then Sophia.
At the school where I was at, they used paraprofessional and aides to provide IEP services, and the law in Colorado says that they only certified SLPAs or SLPs can provide services. So it puts the license of the SLP at risk, and if a parent found out, they could sue the district or the SLP.
Absolutely. Absolutely. That's amazing. But that was done in Tennessee, too. I must say that. Parents didn't necessarily know that the people who were serving as the speech-language therapists may not have had the training, because the law said that if they wrote into their regs that if they could not find someone within the discipline area, then they would be allowed to go outside the discipline. And so you had people that may have had 1 or 2 courses in the area of speech pathology serving as the SLP. In fact, I actually went to the Tennessee Special Education Conference, and I spoke to the special ed directors, and I told them that was in violation of our Code of Ethics. And can you imagine a parent thinking that their child is actually being seen by somebody who's qualified because they don't know to ask the right questions? Because they just assume if you're in that job that you actually have the training. So yeah, that's a lawsuit waiting to happen. Sophia.
Mine just kind of mirrors what you were talking about a slide ago, where you were saying you've got, especially in the nursing home, where you got nurses, nursing assistants, OT, PT, and then the speech therapy. And just with transferring the patients, like I realized I'm such the type of person who, if I've got something to do, I'm going to go in. If I could do it myself, efficiently and quickly, then I'm going to do that. But I found out quickly that it's not my job to be transferring patients. I need to make sure that I've got a nurse or a nurse's aide in the room to do that, and then that way I can, transport them from the room to the rehab.
Absolutely, Sophia. You were putting yourself in.
I know.
Yes, that's all it takes is one fall. That's all it takes. So please, no, if it's out of your scope, don't put yourself at risk. Kelly. And then Sarah.
I just have the school where I used to teach, which was a preschool that served the public school preschool students with disabilities. We had an SLP that worked there, also OTs that worked there, and they were often stepping on each other's toes and arguing about whose role it is, especially when it came to feeding children. And so eventually the SLP also became the boss, so the rule became the SLP was in the mouth and the OT was out of the mouth.
That's right. That's right. Okay. Sarah.
Well, mine was just one of those funky situations. It wasn't that we were in, I guess, I was more like in a moral dilemma maybe instead of ethical. We were just walking down the hall. It was at the hospital. One of the patients was yelling that he had to poop. It was one that we had to do an evaluation on, but we were going to go do another evaluation on another patient. He was needing to poop. His nurse, and he was screaming that out. His nurse was busy with another patient helping them, and I felt horrible, him making eye contact, looking at me like, help me, and I just said, I can't. And then I just said, I didn't know what to say. I just felt terrible.
Yeah. You know what the OT told me about my father? She told me, she said, stay in your lane. And let me tell you why she did that. My dad needed to go to the bathroom. And he wasn't strong enough. You could put the potty by his bed, and if he was strong enough, he could push himself up and get onto the pot. But I don't know, for some reason, I wasn't attending to the pot, and he said to me, he said, give me that. He asked me to give him the pot, okay, the chair with the stool, the pot in it. But the pot had been removed, and I didn't attend to that because the top was down. It was covering the hole. So I just put it right there. And then he got on it, and he pooped. But there was no pot under it. And I was out of the room talking to somebody, and the OT came and found me, and she said, why didn't you call me? And I said, what are you talking about? And she said, you need to stay in your lane. She said, you didn't make sure that the pot was in there, and your father had an accident on the floor. And I felt so bad. I said, I am so sorry. You're absolutely right. It was just that he said to me, give me the chair, and that's what I did. And so had I been in my lane, she was right there. It wasn't like she wasn't outside of the door. I should have just called her and said, my dad needs you, but I didn't. So the big thing we want to learn is to stay in our lane. And if it's really out of your don't take the risk. It's not worth it. It really is not worth it. We got a lot of attorneys that are out there. You see commercials every day with people trying to get you to what? Call them. Their advertising. If you've done this, or if somebody has done this to you, call us so that they can sue. So you definitely can be sued. So you have to make sure that you are doing what is in your scope and that you adhere to your code of ethics and that you definitely have malpractice insurance, because clients know about their rights and they aren't hesitant to make sure that their rights are being respected and not violated. Okay, so that being said, and I do want to say we've got different types of liabilities. And so you need to be aware of that. We have a civil professional liability. This involves claims of harms to a person's health. Failure to fulfill a promise is a civil professional liability, or product misuse or failure. So here's the thing. You never, ever, ever tell somebody that you, as a result of your treatment, they are going to be cured, or that their problem is going to go away. You never make that promise. Once you make that promise and it doesn't happen, you can be sued. Also, check the products that you give them. If you give them a product and it doesn't work, then you can be sued. Now, most of the time, we know how that works in real life. You buy something from a store, it's defective, you can take it back. You take it back and get your money back. You don't have anybody that normally protests that unless, you know, they can figure out that you did something to this thing. But most of the time, people don't even question it. It's the same thing here. You hope that nobody will sue you, but if you give somebody a defective piece of equipment or something to use and they're unreasonable or they get hurt as a result of it, you can be sued. This is civil professional liability, but you also have criminal liability. This includes commission of misdemeanors or felonies that arise out of the conduct of your professional activity. And so we have something called action in tort. Tort is a wrong that involves a breach of a civil duty owed to someone else. So, for example, a plaintiff seeks a remedy for damages to health, physical integrity, property, peace of mind, or reputation caused by the defendant. This is what we call action in tort. So you decide that you think that Mary Sue isn't a competent SLP, and you go out and you start talking about that. This might damage that person's reputation, and they're going to want to sue you because as a result of what you said, their business is lacking, or nobody wants to work with them. So action in tort is a wrong that involves a breach of a civil duty that you owe your patient or someone. Unintentional tort includes negligence. You neglected to keep a log, but you billed for some services. That's also a problem. But misdiagnosis, you actually said that the client was what? Language delayed when the client was not, or the client was apraxic when the client was not. That actually happened. One of the clients that I was seeing was misdiagnosed by a colleague of mine. This is when I was in Columbia, South Carolina. She had a private practice. I knew her well. Her husband was dean of the university that at USC, one of the deans. But the point is that she actually told the family that the kid was apraxic. Well, the family was a foster family, and this guy was a doctor, and he took in foster kids. And this kid was just an abused kid. The kid had been burned with cigarettes. I mean, this was an abused kid. The child was not apraxic. The child actually had a phonological problem, but the child wasn't talking, so she just assumed the child couldn't talk. And she did the wrong diagnosis. So here the doctor walks in, and he's telling me what this child's diagnosis is. And I'm looking at the kid, and I do a diagnostic evaluation, and you know, after a period of time, this child just starts talking, and oh my God, and I'm like, oh Jesus Christ, the kid is not apraxic, but the kid does have this problem. So you got to be careful. I had to be careful what I said to the person because I didn't want there to be a suit involved here, but you got to make sure that you know what you're talking about. You cannot treat somebody inadequately, use the wrong procedure, injuries from equipment. All of these are unintentional things that you do. So you got to be very careful. Intentional tort, though, this is illegal actions that were intentional from the beginning. So assault, battery, failure to obtain requisite consent is battery. False imprisonment, defamation of character, all of these are if you intentionally mean to do this, then you can be sued. These are civil liabilities. Assault could be, and battery, it could be you yelling and pointing your finger at somebody. Or let's say you got a kid that's autistic, and he hits you, and you say, well, I'm going to hit him back because I want him to see how that feels. Do not do that. You cannot do that. Okay, so here are conditions under which negligence can be claimed. You are the provider and you have a provider-client relationship. Once you get into a provider-client relationship, negligence can be claimed. You have a breach of your legal duties, so you don't provide services that you say you're going to provide. There's an approximate cause that exists between the breach of duty and the injury. So like, for example, what I talked about with the water. You waste something on the floor, your clients are coming in, you are busy doing something else, you don't take care of it, person comes in and falls, they break their leg or something, you can be sued. That's negligence. Loss or damage that results from an injury. The person can no longer work because of your negligence. So negligence is what we find to be the most common unintentional tort against SLPs. What I'm going to do is do 2 more slides and stop. And then when we have class next week, I'm just going to talk about your comprehensive examinations. I'm going to go over the rubric with you. I'm going to go so you'll know how your cases are going to be scored, and I'll just tell you what your setup will be because you will be coming for comprehensive exams. So please make sure you're in that class on Thursday. Types of liability. Okay, I'm sorry. We got 2 more slides and then we'll stop. Action. Oh my gosh, I keep going forward. Okay. Action in contract, the practitioner states or implies a guarantee of results of treatment. Never ever guarantee a treatment. If they ask you, well, will I get better, you can say, well, it appears, in fact, even in writing, the client appears to be. Okay, make sure you use words that can back you out of a statement, okay? Product liability, we already talked about that. You dispense a product that is defective. This is a civil liability. Third-party liability, an employee named in the litigation. So I have a private practice. I hire you. You do something crazy that causes me to get sued. So I can seek to litigate you because you put me in the situation. So an employer seeks to litigate the practitioner who serves as a consultant and makes a recommendation that is responsible for the litigation. If I get sued and you put me in the situation, I'm going to sue you. And then, of course, employee liability. The employee is subjected to corporate liability as a result of an employee's action. I mean, I can just be sued because I own the company. Look, everything that happens in the Department of Speech Pathology and Audiology at TSU, I'm responsible for as the chair. That's why I make sure I hold people accountable. That's why I can't, I have to make sure that we follow the rules or that I'm very careful how I handle situations because ultimately, even though you may do it or a faculty may do it, I'm responsible for it. So, any questions about anything we've talked about tonight, guys? And the reason I'm stopping now is because I'm in Colorado and we're taking my brother out to dinner. So my family is waiting for me. Does anybody have any questions? Okay, Denise?
Dr. Smith, can I ask it real quick at the end?
Sure.
Thank you.
Denise?
I'm sorry, if I could ask it at the end after people have logged off just quickly.
Oh, okay, fine. That's fine. Kelly?
Yes. I know that our graduation date or the day that our degree is conferred or whatever is the 12th, correct?
12th or either the 14th. I would have to go online and look.
Okay. Well, my question is, just because my employer for next year is trying to figure all this out, they can't officially hire me until I have my license. So,
they can hire you when your degree is conferred, and then you can apply. When your degree is conferred, you can ask for a go-to-work letter to apply for your license. But as soon as the degree is conferred, our students do go ahead and start employment but they asked for a go-to-work letter. So we'll talk about that a little later. That's
All right.
the lecture.
Thank you.
You're welcome. If there are no other questions, then if everyone will log off and I can speak to Denise, I would appreciate it. So that being said, good night, guys. And Denise, I'm going to stop recording.